Soft tissue sarcoma. Why it should not be treated like a simple lump. Imagine you notice a small lump on your arm or thigh. It isn't painful. It starts growing slowly. Someone tells you, don't worry, it's only a fatty lump. So you ignore it. Months later, you discover it is cancer. I have seen this happen more times than I would like. And many of these major surgeries could have been avoided. I am Dr. Suraj Manjunath, surgical oncologist. Today I'll explain why every lump should not be treated like a harmless lipoma, and also share one simple rule, the 5 centimeter rule, that could prevent a major mistake. What is soft tissue sarcoma? Soft tissue sarcomas arise from muscles, fats, tendons, blood vessels, connective tissue and nerves. They are rare cancers, which is why they are often mistaken for harmless swellings. Awareness is the first step towards early diagnosis. Lipoma versus sarcoma. A lipoma is usually a soft, harmless, fatty lump. A sarcoma may also begin as a painless lump, but it continues to grow and can invade surrounding tissues. Be suspicious if the lump is larger than 5 centimeters, keeps growing, lies deep beneath the muscles, is painful, or comes back after removal. Don't panic, but don't ignore it either. Consult a surgeon experienced in treating soft tissue tumors before anyone removes a lump. The biggest mistake. One of the common mistakes is an unplanned excision. A lump is removed without proper imaging or biopsy because it is assumed to be benign. When the pathology later reveals a sarcoma, the patient often needs another and more extensive operation to achieve adequate margins. The first surgery is the most important surgery. Diagnosis before treatment, proper imaging, that is MRI and sometimes CT, is required. A core needle biopsy is often needed to determine the type and grade of sarcoma. Treatment is then individualized based on the tumor type, size, location, and stage. Treatment. Surgery is the main treatment for most localized soft tissue sarcomas. Some patients also require radiotherapy or occasionally chemotherapy. The best outcomes are achieved through a multidisciplinary team, including surgical, medical, and radiation oncologists, radiologists, and pathologists. Recovery and follow-up. Cancer treatment does not end after surgery. Regular follow-up helps monitor recovery, detect recurrence early, and manage treatment-related issues. Remember, not every lump is cancer, and most lumps are actually not cancer. However, if a lump is growing larger than 5 centimeters, deep-seated, painful, or recurrent, it should be evaluated by a specialist before any surgery is planned. Cancer detection starts with noticing changes in your body. The first surgery is your best chance for cure. Make sure it's the right surgery. If you found this video useful, please subscribe for more evidence-based cancer education.